Mr. Chair.
Representative Mecklin moves that we approve the minutes from last week, February 22nd.
Mr. Chair.
24, yes.
May I ask a question about the minutes?
Representative Jordan.
Thank you, Mr. Chair. So it looks like we have someone here, and we mark his employer, but I don't believe he was here on behalf of his employer. So I don't know if that's proper or not. I guess I'm just asking a question for the minutes.
That was the testifier from Delta.
Correct.
We'll edit, we'll make that change.
Thank you.
So we'll strike that. So with that correction to the minutes, all in favor of approving the minutes from the 22nd, please say aye.
Aye.
Opposed? Minutes have been approved. Don't see Representative Stephenson here, so Representative Berg. Jump in my script here.
4011.
House File 4011. And this is going to Health, Finance, and Policy. If you want to make the motion.
I would like to move my bill 4011 to be before the committee.
And we re-refer to Health, Finances, and Policy.
Yes, please.
Bills before us. If you want to explain your bill.
I do. So this is probably going to be the easiest bill that you'll ever vote on. This was something that I'd bet most of us are not aware of. But once you become aware, it is a horror. So we are talking about surgical smoke. And this is what happens when you use anything that is like lasers or electrosurgical pencils. These are things that, you might have used on you if you have an appendectomy, cesarean section births. Anything that requires those tools gives off smoke, obviously, sometimes called surgical plume. And so what that does for surgical nurses and for the patients, they can breathe in up to, I want to say 150, hazardous chemicals. You can breathe in, yes, gross. You can breathe in the HPV virus, portions of human flesh. This is like a really bad movie, except it's real. And so for the nurses that might breathe this in, it can be like smoking, like 20 to 30 cigarettes a day. So nearly a pack and a half of cigarettes a day over, all the surgeries that they attend and over the course of their lifetime. So what this bill does is require surgical smoke evacuation to be mandated in all of the operating rooms so that we can protect our nurses and also protect our patients. They're a little bit less risk, the patient is, but I mean, if we're talking mothers who are having cesarean section, yes, and they're breathing in that smoke as well as the brand new baby is also breathing that in. And so if we aren't horrified by what it's doing to our nurses, I hope we're horrified about the effects on brand new infants. So that is an overview of what we're dealing with. Sorry, we're dealing with this after lunch. And I do have a couple of testifiers, Mr. Chair.
I have two testifiers on the list. First one is Ann Jones. And if you want to come up to the dais, if you want to have a seat, and then identify yourself for the tape, and then proceed with your testimony.
Chair Nelson and members of the committee, my name is Ann Jones. I'm here to express my support for House File 4011, a bill that would require use of surgical smoke evacuation systems in hospitals and ambulatory surgery centers. I am a retired RN who practiced nursing for over 45 years, 25 of those years in operating rooms as a staff nurse, a clinical educator, and a manager. The two most important developments in surgery other than anesthesia were infection prevention and the ability to reduce or prevent serious blood loss via use of electrical current, which creates heat and thus smoke. During larger open procedures, the entire team is working in a literal cloud of smoke. Surgical masks are not designed to prevent breathing it in, and the most efficient solution is smoke evacuation, taking the smoke away from the field. Surgical smoke is a health and safety hazard that affects operating room nurses, surgical technicians, surgeons, anesthesia providers, and patients, and anyone else present or passing through the room. The adverse health effects of surgical smoke have been known for decades. I've lost count of the number of classes and workshops I attended on the hazards of surgical smoke and ways to prevent exposure. Most facilities have purchased smoke evacuation equipment and all of the associated tools, cautery tips, filters that go with it, but use is not mandatory and compliance remains very inconsistent. I can tell you that a lot of expensive equipment is sitting around unused in hospitals and surgery centers. So, and even though the equipment has gotten smaller and quieter over time, and the handheld devices are more comfortable, resistance among surgeons remains an obstacle. Given the hierarchy that still exists in healthcare, especially in operating rooms, nursing staff tend to defer to surgeon preferences, even when facility policy exists. Staff members really can't choose whether or not to work in those rooms if they are experiencing any health effects. They are assigned. The legislation that you're considering today will make it easier for those of us in operating rooms to do the right thing rather than leaving it up to nursing staff to negotiate with individual surgeons or deciding on their own not to comply. In my experience, safety is best assured by having standardized routines and supported in law when needed. Please vote yes on House File 4011 to protect patients and healthcare workers in Minnesota. Thank you.
Thank you for your testimony. The next person I have on my list is John Zender. And welcome to the committee. Please state your name for the record, and then you can proceed with your testimony.
Chair Nelson and members of the committee, my name is John Zender, and I'm here to express my support for HF 4011, a bill to require surgical smoke evacuation policy for hospitals and ambulatory surgery centers. Thank you, Representative Berg, for sponsoring this bill. I am a professional circulating nurse, and I'm from Crosby, Minnesota. I've been in practice in nursing for 25 years in the great state of Minnesota, and I've worked in healthcare for 35 years. I hold 2 bachelor's degrees from Minnesota State Mankato, a nursing degree from Century College in White Bear Lake, and a master's degree in nursing from Capella University in Minneapolis. I currently work in surgery at the University of Minnesota. I'm also a retired firefighter with 20 years of service. As a firefighter, smoke is an obvious risk of the job, but every big fire I walked into, I was never worried about exposure to fire or smoke. Why? My equipment protected me. Smoke inhalation was never a worry because I carried an air tank that delivered clean, filtered air. Surgical smoke, as they said before, contains 150 hazardous chemicals. Let's go over some of those chemicals, shall we? Carcinogenic and mutagenic cells, toxic gases and vapors such as benzene, hydrogen cyanide, formaldehyde, bioaerosols, dead and live cells, viruses, and blood fragments. In a house fire, oops, I went too far, I'm sorry. In a house fire, many of these, believe it or not, many of these hazardous chemicals are similar. But again, I carried an air tank and wore a mask that delivered clean filter air. Thankfully, in my 20 years as a firefighter, I did not have to experience smoke from burning flesh. Only in the operating room, where we're all expected to be clean and sterile, do I experience burning flesh smoke. In my career as a circulating nurse, I'm often surrounded by smoke with little or no protection. OSHA, on respiratory protection, states, surgical masks used to prevent contamination of the patient are not certified for respiratory protection for medical employees. The Minnesota Clean Air Indoor Air Act, I believe it's also known as the Freedom to Breathe Act, protects employees and the public from health hazards of secondhand smoke. The provisions went into effect in October of 2007. Yet in the operating room, surgical smoke is not protected by that Clean Indoor Air Act. For me, the current generation has a duty to the next generation to pass on our knowledge of what we know and have learned that make our profession better and safer for them. My son Connor is currently in nursing school up at Bemidji State. He has expressed his intent, believe it or not, to enter the profession of circulating nursing. I'm proud he wants to join this profession that I love. But I want Connor and his fellow nursing students to work in operating rooms that are free from harmful surgical smoke. For me, this bill is not just the right thing to do, it's personal. So please vote yes on HF 4011 because it's the right thing to do. Thank you.
Thank you for your testimony. Members, any questions? Seeing none. Oh, Representative Myers,
Thank you, Chair. Thank you, Representative Berg. You know, this one is near and dear to me. My wife is a nurse. She's taken a few years off because we've, you know, had kids, and actually texting her here as we talk about this bill. I wanted to ask in regards to the surgical smoke defined. Do you feel that definition covers everything, including potential for, you know, future technologies under the definition there?
Representative Berg.
Thank you, Mr. Chair, and for the question, Representative Myers. I do have folks here that can come up and answer the question.
Please come to the table and, again, identify yourself for the tape, and then you can answer the question.
Thank you, Chair Nelson, members of the committee. My name is Jennifer Pennock. I work for the National Association representing the operating room nurses. So your question was regarding the definition of the smoke evacuation equipment or the surgical smoke itself?
Representative Myers.
Thank you. Yeah, in regards to like energy generating devices, and it talks about including, I'm just wondering, I mean, do we feel like this is an all-inclusive way that it can be produced through these devices, and is this going to potentially cover any future uses as technologies change?
Sure.
Ms. Pennock.
Mr. Chair, thank you for the question. Our National Association writes a number of guidelines related to surgical procedure, surgical health, and we have a guideline on evacuation of surgical smoke. So in developing this policy language, we were able to consult with our guideline author on evacuation of surgical smoke. I'm not a nurse, so of course I'm not an expert in this area. And our experts on staff were able to say that they believe that it's inclusive of any potential future technologies that we have not foreseen.
Representative Myers.
Thank you for that. That's all I had.
Any further questions? Representative McDonald.
Chair, thank you. Question on the doctors and how do they feel about this? I had heard that they are reluctant for some reason, so I'm just curious as to why that would be.
Sure.
Ms. Pennock.
Mr. Chair. So opinions vary and surgeon preference varies. So some surgeons are early adopters. They've been using the equipment for decades back when it was bulky and cumbersome and loud. Some individuals, surgeons, express concern about use of equipment and don't like it and don't want to use the equipment. There are many options for evacuation of surgical smoke, and it doesn't have to be that handheld device that the surgeon is using. So the hospital or ASC can determine that someone else will stand there with equipment that would evacuate smoke so that it would protect the health and safety of the occupants of the room and not mess with surgeon preference or how they feel they can do their job. We have not had official opposition from an association of surgeons or an association of physicians.
Representative McDonald.
Thank you, Mr. Chair. So if I understood correctly, that perhaps this would require yet another person in the surgery room overseeing that, if the doctor didn't want to hold both that particular device. Is that correct?
Mr. Chair.
Ms. Pennock.
Yes and no. It would really depend on how the facility is staffing that operating room, from the outset. So it's my understanding that, sometimes say a medical resident might be the one stepping in anyway as they're learning right? So it's not necessarily an additional staff member or some of the other staff in the room. It really depends, and what we've done when we've crafted the legislation, asking that facilities adopt and implement these policies, we've done that so that the facilities can have the flexibility to implement what works best in their specific facility.
And Representative McDonald, that's why we're sending it to Health Finance.
Very good, thank you, Mr. Chair.
Representative Schultz.
Thank you, Mr. Chair and Representative Berg. It's fun to learn about a new issue and concern, and I certainly do appreciate that. I feel for the everybody who works in these facilities and this concern. So I just wanted to kind of talk about enforcement to this, and just kind of hear from you a little bit about how you see the enforcement of this bill taking place across Minnesota.
Representative Berg.
Thank you, Mr. Chair, and thank you, Representative Schultz. So it's my understanding that this would fall under OSHA from the Department of Labor. And so it is fortunate that we passed a labor bill last session that gave us 5 more OSHA investigators. And so what I want to say about this is, when you have a safety-sensitive job, and by no means am I comparing being a flight attendant to a surgical nurse. However, there are reasons why we have policies, rules we have to follow, procedures we have to follow consistently across every airline, every base, because it matters. Those seconds matter. And so when you're in an environment like this and you are literally saving human lives, improving human lives, the consistency that's needed across every facility just makes it easier for each facility to run well, to protect patients and nurses and whoever's in the room, whether it be surgeons or interns. And so I think that's important to say as we're talking about enforcement, because that is a necessary piece of this. And so that was just a long explanation for your very simple question.
Representative Schultz.
Thank you, Mr. Chair and Representative Berg. Do most healthcare facilities, do they already have this equipment and it's just not in use, or are we anticipating that this is going to be an additional cost to them in this calendar year?
Representative Berg.
Thank you, Mr. Chair, and thank you, Representative Schultz. Yes, most of the facilities already have this equipment. As our testifiers were talking about, some surgeons choose not to use it. The original ones, as I believe Jennifer said, were a bit cumbersome, and surgeons didn't want to have that extra device to hold in their hands and have to be responsible for. However, yes, by and large, most facilities already have the equipment. It is getting the surgeons to use them and the enforcement mechanism to ensure that they are.
Representative Schultz.
Thank you, Mr. Chair and Representative Berg. Can you help us out by kind of maybe outlining what the cost of this equipment is for those who don't have this equipment already? And the reason for my question is to hopefully eliminate the barriers to these healthcare facilities obtaining them. I represent a rural community. Access to rural healthcare is, challenging at times, and I certainly wouldn't want to see additional burdens on struggling healthcare facilities and the access that it provides, especially for rural residents.
Representative Berg.
Thank you, Mr. Chair, and thank you, Representative Schultz. By and large, this is not going to create an undue burden, and we did actually in our discussion focus on those smaller rural hospitals and facilities. I am going to let my testifier give a better answer, but I just want you to know that that was a consideration in this legislation.
Ms. Bennett.
Mr. Chair, and thank you for the question. So in terms of the costs of the equipment, costs vary, much like everything in U.S. healthcare, right? So there oftentimes you might use a good comparison of the electrosurgical pencil that has the smoke evacuation and that doesn't. And there might be a difference in that individual piece of equipment. I have heard anywhere from $3 to $20 per. The equipment that evacuates the smoke is attached to a smoke evacuator system that filters the smoke. So there's the suction tube, it filters the smoke, it has an ULPA filter. It kind of reminds me of first generation VCR, if you're thinking about the box. It's mobile, it can move from OR to OR. Those can be thousands of dollars. Often, when you are negotiating and working on your capital budgets and identifying the device company that you're going to go with, you can negotiate, say, that box free for the guaranteed purchase of so many of those pencils, or vice versa. So it really just depends what the company, what you've negotiated in terms of your purchase and your costs. For the rural facilities, there will be a lower volume of surgeries than there would be in an urban facility, so that certainly helps. And we did, as Representative Berg mentioned, the majority of facilities in Minnesota have the equipment. AORN surveyed our members ahead of working on this legislation, and 95% of our respondents, which included rural, urban, outpatient, inpatient, and ambulatory surgery center, 95% indicated that their facility had the equipment already.
Representative Schultz?
Thank you, Mr. Chair. Following up on your question and then talking about, how we navigate, especially those smaller systems, this may be a little bit of a rhetorical question, and I don't mean to belabor the point, but just generally, do we feel like a mandate is the best approach to this challenge to get the best compliance and the best results for all healthcare facilities?
Representative Berg.
Thank you, Mr. Chair, and thank you, Representative Schultz. I know you love talking about mandates, so happy to oblige. So one thing I want to mention, which is why it's fantastic to have experts in the room, is actually DLI has grants available for hospitals and the other facilities that might want to invest in this or upgrade. And so that's fantastic in terms of taking the burden off of some of the facilities. In terms of mandates, if I were you, I think I would look at it more as what is it that we can do as a state in partnership with our experts to help protect our people, right? We ran for office. We're here to do good things for Minnesotans. Let's do that.
Representative Jordan.
Thank
And
you,
we need to move along on this because we got other bills to get to, and so Representative Jordan.
Thank you, Mr. Chair. I just wanted to point out that if you look at the fiscal note on page 2 under assumptions, it outlines in quite detail that how MNOSHA plans on doing the compliance with this bill and outlines quite a bit. It also says that they, to read from the fiscal note, MNOSHA has reached out to several different healthcare facilities within the cities as well as northern and central Minnesota. And they've all responded that each one currently has a smoke evacuation system, with many employers already using this technology, and then talks about how, and much of what Representative Berg said. So, you can take it from Representative Berg, or you can read it in the fiscal note that details all the costs and assumptions there. So, I think it's just a good idea for us to look at the material, because often our questions can be found there.
Thank you, Representative Jordan. Representative Kozlowski. Representative Myers.
Thank you, Chair. Representative Berg, I just had a question in regards to, if you can answer or somebody else can, subsection 2 talking about policies that prevent exposure, and then the specific word requiring. I'm just wondering, in emergency situations at a hospital, I'm just trying to see if this is covering everything. Are there those times that you can't always be prepared and it may happen, and potentially what's the potential liability of that for a hospital or the people that are impacted by this?
Representative Berg.
Thank you, Mr. Chair. I am going to let one of my testifiers answer that so that we can have the most correct and responsible answer. Thank you, Representative Myers.
Ms. Penick.
Mr. Chair, and thank you for the question. So even in an emergency procedure, there's a plan in place. You know, the facility has a plan in place how these operations will be handled. So, and if the equipment is available in the room, and that is the equipment you use, then that is how the surgery would be performed, if that makes sense.
Representative Meyer.
Yeah, thank you. I just want to make sure that, you know, I'm not a doctor. You know, I watch a lot of shows on TV that maybe, you know, put some crazy situations out there. You know, I just want to make sure that if there are situations where, again, somebody comes in and you got to do something quick and it's not prepared, I understand with an operation, you know, a surgical plan in place, but I'm assuming there's times where there's not. So I just want to make sure that, you know, there is maybe that little room in case something like that happens, that maybe, you know, you're not going to get a huge fine on something. Just something to consider.
Ms. Penick, and I'm reading it, it says they should adopt and implement policies. That could probably be part of their adopting and implementing the policies is for those emergencies that you're talking about, have something in their policy that deals with that. Ms. Penick.
Mr. Chair, you took the answer right out of my mouth, so thank you.
Scary. Any further questions? If not, all those in favor of Representative Berg, if you want to quick wrap up and then renew your motion.
Absolutely. So I love Representative Jordan pointing out the obvious. We all have all sorts of papers, so Representative Schultz, you do not have to take my word on any of this. Go ahead and study your packet. I think that we can agree that this is kind of one of those duh moments where we just want to protect the folks that are in the most vulnerable situation. You will see on one of your handouts the number of states that have already passed policy like this, so it is clearly a movement to make sure that our people are safe and well cared for, as well as the people that take care of us. And so it's the AORN handout, and you can see at the very bottom the number of states that have implemented this. So with all of that being said, all of the great answers from our experts and the really sort of gross and nasty details that we all got to learn about today, I renew my motion to re-refer House File 4011 to Health Policy and Finance Committee.
The motion's been to move House File 4011 to Health and Finance and Policy. All in favor, say aye. Aye. Opposed? The ayes have it. The bill's referred. The next bill we have is Representative Stephenson, House File, get the number right, 3488. Welcome to our committee, Chair Stephenson. And I'll move House File 3488 to be referred to Commerce. I think you had a favorable chair there.
I don't know. I hear he's a real jerk.
So, Representative Stephenson, you want to explain your bill? And do we have an amendment? Yeah, there's an amendment. I'll move the amendment 3488, the A3 amendment. And you want to explain what the amendment does? And
Mr. Chair, the A3 amendment makes some technical changes. It clarifies the content removal provision. The biggest thing that it does, and I'll speak more to this in my opening remarks, is it bars minors under the age of 14 from being engaged in the work of being a social media influencer. That's on line 1.7.
members, the amendment, the A3 amendment, all in favor of the A3 amendment to put the bill in the order the author would like, please say aye. Aye. Opposed? The ayes have it. Representative Stephenson, Chair Stephenson, explain your bill.
Thank you, Mr. Chair, members of the committee. This bill relates to children working as social media influencers. Many of you are probably not familiar with this concept, so let me read you the story of Samia as told by the New York Times. Samia was an influencer before she could talk. Her parents, Adam and Latoya, are influencers themselves and began chronicling Samia's impending arrival on YouTube and Instagram in 2014 once they learned they were pregnant. Samia's birth video is on YouTube, so she's pretty much been born into social media. Samia is now 4 and has 143,000 followers on Instagram and 203,000 subscribers on YouTube. Her feeds are mostly populated with posts of her posing and playing, but they also feature paid promotion for brands like Crayola and Homestyle Harvest Chicken Nuggets. Members, this can be big money. According to the Washington Post, mom influencing is a billion-dollar industry. Kyle Fisher, the father of 2-year-old identical twins who have more than 2 million followers on Instagram, said a sponsored post on the girls' account fetches between $10,000 and $20,000 each. Members, this industry also has a very dark side. A Utah influencer named Ruby Franke was charged with multiple counts of aggravated child abuse as her 12-year-old son showed up at a neighbor's home, malnourished and with open wounds. Franke's YouTube channel documenting the lives of her 6 kids had over 2 million subscribers. Franke's channel promoted severe punishment, going without food, intense manual labor, and other extreme and odd punishments. One child reported being forced to sleep on a beanbag for months as a punishment. Franke has pled guilty and is going to prison. Her YouTube channel was generating an estimated $1,000 per week. NBC reported on the story of another child influencer. Cam said that their mother began posting photos and videos of them on MySpace when they were in the 2nd grade. They didn't comprehend how many people were watching them grow up, Cam said, until their mother joined Facebook. Cam assumed that their mother knew her thousands of friends personally, so they often accepted requests from random adults because their mother was a mutual friend. As a result, they'd sometimes receive disturbing messages. Quote, "I remember when I was 12 years old and I was riding my bike with my friends around town that we lived in at the time and getting a Facebook message the day after. 'Hey, I saw you riding your bike,' Cam said, and it was from an older man. It made me very uncomfortable." Or consider the concept of mommy-run accounts. These are social media accounts purportedly for young kids, but actually run by their parents. Some of these accounts feature scantily clad pictures of tween and preteen girls. Some of these accounts offer access to even more content behind a paywall. And members, I'm going to hand out, there was a New York Times article just last week on this subject that I printed out for you. I'm going to read a couple key excerpts, but I really, really encourage you to take the time to read the whole thing, but not over the lunch hour, because it will turn your stomach. It's really vile. Alyssa has been running her daughter's Instagram account since 2020, when the girl was 11 and too young to have her own. Photos show a bright, bubbly girl modeling evening dresses, high-end workout gear, and dance leotards. She has more than 100,000 followers, some so enthusiastic about her posts that they pay $9.99 a month for extra photos. Over the years, Alyssa has fielded all kinds of criticism and knows full well that some people think she is exploiting her daughter. She's even gotten used to receiving creepy messages. But these were extreme. Quote, "I think they're all pedophiles," she said of the many online followers obsessed with her daughter and the other young girls. Alyssa and her daughter inhabit the world of Instagram influencers whose accounts are managed by their parents. Although the site prohibits children under 13, parents can open so-called mom-run accounts for them, and they can leave on even when their girls become teenagers. But what often starts as a parent's effort to jumpstart a child's modeling career or win favors from clothing brands can quickly descend into a dark underworld dominated by adult men, many of whom openly admit on other platforms to being sexually attracted to children, an investigation by the New York Times found. Thousands of accounts examined by the Times offer disturbing insights into how social media is reshaping childhood, especially for girls, with direct parental encouragement and involvement. Some parents are the driving force behind the sale of photos, exclusive chat sessions, and even the girls' worn leotards and cheer outfits to mostly unknown followers. The most devoted customers spend thousands of dollars nurturing the underage relationships. The large audience boosted by men can benefit the families, the Time found. The bigger following looked impressive to brands and bolster chances of getting discounts, products, and other financial incentives. One calculation performed by an audience demographics firm found 32 million connections to male followers among the 5,000 accounts examined by the Times. Interacting with men opens doors to abuse. Some flatter, bully, and blackmail girls and their parents to get racier and racier images. The Times monitored separate exchanges on Telegram, the messaging app, where men openly fantasize about sexually abusing the children they follow on Instagram and extol the platform for making the images so readily available. "It's like a candy store," one of them wrote. "God bless Instamoms," wrote another. Account owners who report explicit images or potential predators to Instagram are typically met with silence or indifference. And those who block many abusers have seen their account's ability to use certain features limited, according to interviews and documents. In the course of 8 months, the Times made over 50 reports of its own about questionable material and received only one response. Meta, Instagram's parent company, found that 500,000 child Instagram accounts had inappropriate interactions every day, according to an internal study in 2020 quoted in legal proceedings. Some of the descriptions of these accounts also highlight the revealing nature of the photos. One account from a child around 14 years old encouraged new signups at the end of last year by branding the days between Christmas and New Year's as Bikini Week. An account for a 17-year-old girl advertised that she wasn't wearing underwear in a workout photo set, and as a result, the images were spicier than usual. Members, this is vile. This is disgusting, and we cannot allow it to continue. The amendment that was just adopted would ban this type of activity for children under the age of 14. Most social media platforms, due to federal law, set the age at which people can have accounts at 13, which is the reason for that age. It also ties in with our existing child labor laws in Minnesota, which prohibit, with limited exceptions, any employment under the age of 14. So that's the reason for the age. The bill, before coming to this committee, ensured that to the extent that children are being monetized by their parents through these accounts, that they receive some of the benefit from it. It required a trust to be set up and for a portion of the funds to be deposited in this account. That concept might sound familiar to you members because it's been in place in the TV and movie concept in California for many, many years as a result of some golden age of Hollywood scandals involving child stars who saw all of their earnings wasted by their parents. So that's a familiar concept. The last piece of the bill that's worth mentioning is a provision that allows children to demand that the content that features their likeness be removed. And again, that age is at 13, which is consistent with the federal law there. So that's the bill. And I'm happy to answer questions, Mr. Chair.
Thank you. Chair Stephenson, do you have any testifiers at all, or?
I didn't bring in any, no.
That's fine. That's Representative Jordan, you had a question.
Thank you, Mr. Chair, and thank you, Representative Stephenson, for coming to our committee. All joking aside, thank you for bringing this bill. This is pretty horrifying. I read this New York Times piece, and to be reminded of it just kind of shows the urgency of this bill. I am wondering, though, about responsibility that social media platforms have. I think when we discussed, under the leadership of Representative Robbins, I believe, the prevalence of young girls and individuals who are on social media and eating disorder content. Is there any, and there was some, with that, there was discussion around responsibility of the social media platforms themselves. Is there any discussion around holding these companies accountable for some of these actions in addition to the individuals creating the content themselves?
Representative Stephenson.
Mr. Chair, Representative Jordan, there is discussion about that. In this bill, the onus is on the parents, although I do want to note that the prohibition on doing the work of content creation under the age of 14, the enforcement mechanism there is something that we're going to continue to talk about and work on as the bill moves to the next committee, and I think that there could be a role for the platforms in that particular piece of this bill. But I also want to highlight this is one of several bills that are moving at the legislature this year that relate to the issue, to the massive problem that we have of the impact of social media on young people. So you mentioned Representative Robbins' bill. Representative Bonner, of course, has the age-appropriate design bill. There's also, the Attorney General did a report on social media and its impact on kids and kids' mental health. And I encourage members to read that report if you haven't. It's great. That I turned that report into a bill that was introduced last week and will be heard in the Commerce Committee next week, and that places more restrictions on the platforms as well.
Representative Jordan.
Thank you, Mr. Chair.
Any further questions? Representative Mecklen.
Thank you, Mr. Chair. Representative Stephenson, I very much understand how gross a lot of this is. There's several pedo hunter groups out there, several of them I follow on social media. They do a really good job of going around and finding these people and bringing law enforcement there. So I get all that side of it. However, what about a family, and I can think my niece and her husband, they have a young son who is very gifted, and they do a lot of video content. motocross and snowmobiling. Kid can do amazing things. If they monetize it, do they get caught into this?
Representative Stephenson.
Mr. Chair, Representative Meckland, the bill would not allow that kind of activity for young children, for children under the age of 14. So they would not be able to monetize it under this bill. Above that age, they would be able to monetize it, but they would need to set aside a portion of the funds for the child in a trust account.
Representative Meckland.
Thank you, Mr. Chair. And why, if you have like, I mean, I understand there's a dark side to everything. And that's what we have Child Protective Services for. And from what I gather, I mean, this is a very sensitive, I'm not looking at or trying to defend that side of it by any means. I want to make that clear. And from some of these groups, that I mean, I've talked to a few of them, it's because of the social media, they're actually able to find them and identify them. And I do realize I'm not that good at social media, but there's a lot of paywalls, and I don't know anything about that, or dark web. But I'm more concerned about, for those that are doing absolutely nothing wrong, there's a family that they live on a sail ship, they travel the world, and they document the whole thing. That's how they make their living. And yes, their kids are all part of, they do chores, and all the stuff, they fish, so in that instance, this would prohibit that, is that correct?
Representative Stephenson.
Well, Mr. Chair, Representative Meckland, a sail ship around the world, it's outside of Minnesota. So setting aside that specific example, right, because this only pertains to stuff that happens in Minnesota, but your point is accurate, that for kids under the age of 14, this does not allow that to continue. I would argue two things. One, we have had laws against child labor in this state under the age of 14 with very limited exceptions for many decades. And this builds out from that and says that this particular instance, we're not going to allow this to fit in the existing exemptions that exist for modeling and acting, for a very good reason, because this dark side that we're talking about is inextricable from the other thing. I spent most of the interim trying to figure out how to slice off a piece of this or come at just this part, but due to the way that social media works, and frankly, due to the First Amendment, that's impossible. You can't make a content-specific law. You can't say that we're going to allow you to have this type of content, but not that type of content. What we can say is that children should be children, and they should not be engaged in this kind of behavior. We've made that decision for a whole host of jobs. Most jobs, 99% of jobs, you can't have if you're under the age of 14 in Minnesota. And the cost of that dark side is so immense that we have to take action against it.
Representative Meckland.
Thank you, Mr. Chair. That part I very much understand and agree with. So where is AFTRA and SAG on this? Like, if you take a clip out of a movie or a commercial or anything to that, and if you post it on social media and it goes viral, how do you delineate? I mean, I'm asking questions because I'm sitting here thinking, like, if my niece, for example, a different one, was at a rodeo or something, I don't know, 10 years ago, and she took a video, and it ended up going extremely viral, and she made, I don't know, a couple $1,000 on it. So if there was a kid in that video in a public setting, how would that work when she doesn't even know who that person is? They're in the distance, you know what I mean? Because it was these big balls they put on, and when the bull came and hit the balls, and the people went flying, and apparently Germany sucked that thing up like you wouldn't believe. The point is, how do you not avoid violating something that you don't? I mean, it's an innocent thing. Like, it has nothing to do with, like, in that case, she had no idea that it could even be monetized. It was only because it went so excessively viral so quick that somebody notified her, you need to do whatever you need to do. I don't know how that works, and she did end up making money on it. And if there happened to be a kid in this thing, then she would be in violation. Is that correct?
Representative Stephenson.
Mr. Chair, Representative Meckland. Well, she wouldn't be in violation for posting the video necessarily. It's only for accepting, it's the exchange of money for services that becomes problematic in terms of the ban. And again, it also depends on the age of the kid, right? If the kid's over the age of 14, then you can accept the money. You just have to set aside some of it for the kid when they reach the age of adulthood. And you asked about the Screen Actors Guild and another organization and made reference to sort of traditional methods of broadcasting. That is not the intent of this bill to get at that, to get at, kids who are appearing in movies or TV shows, because that is a more regulated, controlled environment where we can be certain that the kind of stuff that's happening, that's documented in that New York Times article I gave you is not occurring. So there is a distinction there between those more traditional media sources and the social media influencing world that's both in law, and that's the intent of the bill, to focus in only on the social media influencing.
Representative McClellan, one final question, then I've got other people.
We'll just leave it there. Thank you, Mr. Chair.
Representative Kozlowski.
Thank you, Chair, and thank you, Rep. Stephenson, for bringing this bill forward. This is one of the direct links into a lot of the work that brought me to the legislature and really creating essentially communities that are free of violence, right? In that this is about dehumanization of our kids, of families who are then get pulled into it and monetizing and into these cycles that hypersexualize, dehumanize our kids. And this is an on-ramp onto sex trafficking. And so I pulled up the report on missing, murdered Indigenous relatives, and I know at the Capitol, I'm really proud of the work that our representatives and colleagues and community are doing around missing, murdered African heritage folks this year. We're also bringing that work forward with our Latino community. We also know that this hypersexualization impacts Asian heritage folks at alarmingly high rates. And I'm just curious, if there's space or interaction or conversations that you've had with the offices of missing, murdered Indigenous relatives, and as MMAH gets up and running around the prevention and data collection, maybe around making sure that we're, preventing this from going further than into sex trafficking and other physical, emotional harm. But the resources, the investigation, accountability, and justice should it happen. And if there's some work that we could do to make sure that those offices and systems of data are communicating with each other so we can prevent, and then also make sure that we're holding folks accountable to make sure that more harm isn't being done. So I really appreciate you bringing this forward, and thanks for all your work.
Representative, that sounded more like a statement than a question.
Well, Chair,
Representative Kozlowski?
I think the question is, Sir Representative Stephenson, can you or have you had conversations with the offices of MMIR and MMAH that can make sure that this bill is interacting with those offices and the prevention work and the accountability work for our specific communities that are being most impacted by this on-ramp into those exploitation?
Representative Stephenson.
Mr. Chair, Representative Kozlowski, I haven't, but I certainly can, and I think it's a good idea.
Representative McDonald.
Thank you, Mr. Chair. Representative Stephenson, thank you for bringing this to the attention. We live in a sick world, and there are sick people. Period. Exclamation mark. So it's an important issue to discuss. The question, though, that I have, a couple of them just regarding, because there's a lot of bad actors, obviously, out there, and most of your testimony was of that nature, and rightfully so. I hope that you give that speech on the House floor as well, and you can be assured that the minority group won't stop you from reading out of a piece of paper and exposing the filth that we live in. But there are a lot of good folks out there doing some fun things in their family. I think by exposing a child from their day of their birth until they're 15 or 18, and every aspect of their life is a foolish gesture on behalf of the parents. So maybe I'll get a little kickback from that, but I would never do that to my family, and I would presume you wouldn't either. But that being said, because of a lot of good folks doing work, advertising their businesses with their children, not necessarily to be an influencer, but to promote a family small business, would this prohibit, if there are in a 30% of the material, in the content material, in that material, 30%, would this prohibit or they would be subject to the same laws should this pass?
Representative Stephenson.
Mr. Chair, Representative McDonald, I don't believe, your question, as I understand it, is if a business engaged in advertising had kids in the ad, would it fall under this? I don't believe so, because it's not direct money in exchange for the content in the way that this is structured. And there should be a delineation there. I would say that what you're talking about, existing child labor law says that you can't work under the age of 14, and then there are limited exceptions, and one of the exceptions is modeling. And to me, that's probably akin to what you're talking about, modeling and being an actor or actress. Acting is another exception. So that's where I think that falls under the law, not under this provision.
Representative McDonald.
Mr. Chair, thank you, Representative. Now, would nonpartisan staff, could they weigh in on this, just to confirm that? I think Representative Stephenson brings up a good point, and the delineation between my concern and his bill.
Chair and members, this is Mary Davis from the House Research Department. I think that the place you want to look in the bill is at the content creator, which is on line 1.19. So kind of like what the representative was saying, the person who creates the video for compensation. In an advertisement, people aren't paying you for your advertisement, you're paying other people to publish your advertisement, as opposed to the content creators who are making the content in order to receive a stream of income.
Representative McDonald.
Thank you, Mr. Chairman. Under that section 1.21, when it says Minnesota in exchange for compensation and includes any proprietorship or partnership, would you think that would have any ambiguity or vagueness in my scenario? Because now, for example, as a photographer, I post ads, and when my kids were young, we'd use them for promoting a bunny special or Christmas Santa Claus pictures or whatever. There's a lot of small families, businesses that do that. But I would think that if under that particular 1.21 includes any proprietorship or partnership, would that bring them into this language or not?
Ms. Davis.
Thank you, Chair and members. The sentence goes on to say if they're assuming the name or identity of a particular individual or family members. So if the business is operating under the name of like a single family member, like a mom, and they were putting their kids in the content in the way that the bill is intending to prohibit, then it would cover them. I believe that would be the intention, but that would be a question for the author.
Representative Stephenson, and I guess the question I have along that, I think what he's getting at is if he takes pictures of used pictures that he's taken of his kids or of other people's kids and use it as advertisement for his photo studio, would that be covered? I think that's where he's getting at.
Or a clothing store.
Or a clothing store or whatever, yeah, but Representative Stephenson, Ms. Davis.
And Mr. Chair, and Ms. Davis will correct me if I'm wrong. I'll start by saying the intent of the bill is not to capture that type of advertising, right? The intent is to capture social media influencing, where the content is generating income directly to the person, which advertising is not. So I don't believe so. Certainly something that we can keep looking at as the bill moves on to the next committee, because as I said, the intent is not to capture advertising, it's meant to capture influencing. I think, though, that this line of questioning is valuable in another respect, in that it illustrates the problem with a more narrowly tailored approach that Representative Meckland was kind of hoping we could find, that just goes after the bad influence, because this is a place where drawing these lines is very difficult, and the involvement of the First Amendment makes it even harder. So I just wanted to reference that, like, this is why, after thinking about it for a long time, I think the only solution is to say, if you're under this age, you can't do social media influencing, because drawing these lines is really difficult. And to the points that Representative Kozlowski was making about this being an on-ramp to sex traffic and all the terrible things. And again, take a look at the New York Times article when you have a chance, because it's all in there about where this goes. The harm is so immense that we just need to put a stop to it.
Representative McDonald.
Mr. Chair, yes, thank you, Representative. No, I was aware of the intent. I just wanted to be clear on that. And I read another article in the Washington Times. It's a $16.4 billion industry as of since of 2022. And it does hurt minors. For the most part, it can harm them, as some of the things you read. Then just in closing, have you thought about putting language in there? In the state statute, we have obscenity laws, decency laws. Have you thought about putting that content in your bill to prohibit thereof making any sexually implicit material, video, or any content of a minor? That would certainly really solidify and get to the bulk of where your statement is, we got to stop this.
Representative Stephenson.
Mr. Chair, Representative McDonald, so as you indicated, Minnesota has laws that relate to things like child pornography, for example. The problem with this activity, as you can maybe tell from the article, is it exists on the periphery of those laws, which makes enforcement a challenge, right? And that's what was in the article as well, is that, this stuff gets reported and nothing happens, and it's right on the edge, which is another, I don't mean to keep beating on this, but I understand the instinct to want to find a more narrowly tailored way to solve the problem. I just don't believe that there's a functional way to do that. When I explored that avenue, looking at the existing laws we have about child pornography, looking at child protection, these are systems that are already in place and very clearly are not well-suited or up to the task of this challenge. And so we need to think of a different solution if we want to stop the behavior, and I want to stop the behavior.
Representative Mecklin, you had one quick question.
Yeah, just in hearing all this, has any other state passed this? And if they do this since they live in Wisconsin, how does that affect what is viewed in Minnesota or in any state? I mean, we kind of had a similar thing the other day with earn sick and safe time with the airline pilots, because where are you and where did it come from, where are you going, all that kind of stuff. And is there potential here for, like, can it just be banned in a state, like no matter where it was made, or how do you address all that?
Representative Stephenson.
So the bill bans the Minnesota minors' involvement in it. So the way that I would say it is that what this bill does is protects Minnesota kids from this industry. We obviously do not have the ability to protect Wisconsin kids or North Dakota kids or New Hampshire kids from that. That's either got to be a federal thing or a state-by-state thing. I'm not aware of any other state that has passed the ban. The trust language is law in Illinois, and many other states are considering it. It just passed in Illinois like a year ago. And I think there's maybe one other state that has done the trust piece. But the ban place we would be the first that I'm aware of. I think that, social media, I remember when I was in college when Facebook was rolling out, which was a very short time ago, right? So that just meant to say that this is an emerging problem. We are behind on it as a society, I believe. I believe that we have not done nearly enough to put guardrails on social media in terms of its impact, particularly on young people. But legally, this is an emerging space, and a lot of different states are throwing different ideas on the table. A lot of them are bad ideas that aren't going to work. But I think this is a novel solution that we haven't seen elsewhere yet.
One simple thing. Is it Stephenson or Stephenson? I mean, we both got elected the same year, and I thought I knew it, so I'm just curious.
Mr. Chair, it is Stephenson.
And Representative Macklin, I've had the same issue. You look at the way his name's, I know people that pronounce it Stephen, but he says it's Stephenson, so that's why I've been saying it that way.
But, Mr. Chair, if I can say that I've been called much worse.
Right.
So,
I used to say, I don't care what you call me, just don't call me late for dinner. Representative Schultz, one final question and make it quick so we get to our next bill.
Thank you, Mr. Chair and Representative Stevenson. When we look at this bill and this underlying conversation and the need here in Minnesota, do we have any way of tracking how prevalent this is in our state? And if so, do we have a range or an estimation as to the amount of people impacted by this today?
Representative Stevenson.
Mr. Chair, Representative Schultz, no, we don't. The truth is that social media has been almost completely unregulated at the state, certainly at the state level, but even at the federal level. And it's a big problem because it's having massive impacts on our society and our community, literally impacting people's brain chemistry in terms of the dopamine releases, which form an actual addiction mechanism similar to being addicted to a substance, right? I mean, it's a big problem, and we don't have that data. I wish we did.
Mr. Chair.
Representative Schultz.
Representative Stevenson, I noticed in your bill, and unless it was clarified in the amendment, I noticed particularly, I think it's line 2.3 here. It excludes someone who is producing their own video content. And so my question along those lines is like, is that the right policy for us to be pursuing amidst the concern for kind of that, whether it's mental health or the concern for children in our state? And should we be buttoning that up more?
Representative Stevenson.
Mr. Chair, Representative Schultz, I think that's a great question and something that we should keep talking about as the bill moves into the next committee. I can tell you the reason why that's there. This bill started out with that trust account, trying to ensure that money, that parents just didn't take all the money for themselves. So if you had content that was being created and posted by the kid, the trust presumably wouldn't be necessary in that scenario. Now that we're including the ban, I think that's a question that's worth kind of thinking about and thinking about how you would deal with that.
Representative McDonald, last question.
Thank you, Mr. Chair. Representative Stevens, I thought it was Stevenson's, then last year someone said Stephenson's, so, I mean, we've been working together for, I don't know, 10 years now?
I think there was a comment from this side of the aisle that threw you
Yes,
off.
it was Representative Kozowski, I heard her.
No, Jordan, right? It was Jordan.
Oh, it's Jordan? Oh, you're the guilty.
Representative Jordan,
Like, nice going.
Chief Troll.
Redheads are trouble.
Yes, they are.
Representative.
So the quick question, Mr. Chair, is Representative Stevenson. Now, I know of some, I don't know if they're YouTube or influencers necessarily, but they have some hunting and fishing and farming videos. Whether or not it's 30% of the content creator's compensated video is produced within a 30-day period, I do not know. But if it is, and that young 13-year-old is hunting and fishing with his dad or farming, and they're doing some fun things on social media, that in your amendment, that would prohibit maybe a 13 or 12-year-old to be with his parent to create that content in a good way. Is that correct?
Representative Stevenson.
Mr. Chair, Representative McDonald, this kind of goes to what Representative Mecklin was asking a while ago, and the answer to the question is if it is for pay. So if you're doing a video, and it doesn't matter if you're doing it hunting, fishing, sitting around the house, whatever else, and you post it, you know, a cute picture of your kid doing something cute and you put it on Facebook, that's not banned by this bill. What is banned is the monetary relationship, the work. And that's why this is in the, you know, same chapter of law as the child labor provision. And then, of course, is that 30% 30-day thing that you alluded to is also a limiting factor. So if you post one video, it doesn't fall within that. And I acknowledge that this bans minors from engaging in activity beyond what, you know, the New York Times was talking about. But just as our child labor laws flatly say under the age of 14 you can't work except for these exceptions where we have some discrete cases about why this should be allowed. I'm saying this shouldn't be allowed, you know. Right now, we have, you're under 14, mostly you can't work, here are some things you can, and a lot of things you can't. I'm saying this belongs in the can't category.
Representative Hussein. Okay, and I'm losing control here, but we need to get through this.
I'll keep it short and simple. And Representative Stephenson, thanks for bringing this bill forward. It happened a story in my district, not too far away. Someone put a picture of a minor in a social media, and some for the two family was kind of, you know, fighting over for nothing, but there's nothing could be done unless some people has to call the social media and they have to take it down. But mentally, that little child and the family has been hurt. And thank you for bringing this bill forward. It's social media is getting crazy and it's getting outraged, and minors have no protections when it comes to social media. We've seen in Instagram and Facebook, but this will help and protect for identity for those kids when they grow up. And I look forward supporting this bill, and thanks for bringing forward. And we should protect our young generations.
Thank you. Representative Stephenson, if you want to wrap up.
Well, Mr. Chair, I appreciate the generous allocation of time, so I'll just say it's a very good and important bill. Please vote yes.
And I'll renew my motion that House File 3488, as amended, be re-referred to the Commerce Committee. All those in favor say aye. Aye. Opposed? Ayes have it. The bill is referred. And the last bill we have today is House File 3957, Representative Greenman. And this bill is going to
Judiciary.
Judiciary. So you want to make your motion?
Thank you, Mr. Chair. I move that House File 3957 be re-referred to Judiciary, Policy, and Finance.
And I do not see an amendment, so proceed with your
Thank you.
explanation of your bill.
Thank you, Mr. Chair. And with 20 minutes left, I promise you this will be the bill that does not turn your stomach, and you also know how to pronounce my name. So what this bill does, and I'm going to turn it over to the DLI's Deputy Chief General Counsel, but this is the OSHA technical bill, which includes language modifications and clarifications in OSHA in 4 areas: in the warehouse worker safety language, OSHA Safety and Health Review Board, the ergonomics policy that we passed last year, and data sharing provisions. So with that, I will turn it over to Deputy Chief General Laura Zajac. Did I get it right? Okay. Mr. Chair, if that works for you.
And if you want to introduce yourself for the tape, and then you can proceed.
Thank you, Chair and members. My name is Laura Zajac. I'm Deputy Chief General Counsel at the Department of Labor and Industry. Thank you for the opportunity to testify in support of House File 3957. Section 1 revises definitions of employee and employer in the Warehouse Distribution Worker Safety Act, which passed last year. The Revisor's Office pointed out a concern that there are general definitions of employee and employer in Chapter 182, and as written, there may be a lack of clarity as to whether the general definitions also apply to Section 182.6526, since that section also contains definitions of the same terms. The revisions would make clear that both the general definitions of employee and employer that apply to the OSHA Act and the specific definitions that apply to the Warehouse Distribution Worker Safety Act work together. Additionally, there's language to make more precise what it means to be a non-exempt employee by cross-referencing the definition in 177.23, which governs labor standards. At Section 2, we propose a change to Section 182.664, which governs the Occupational Safety and Health Review Board. This makes clear that public meetings can be closed for deliberation by the board members in accordance with the board's longstanding practice. The Occupational Safety and Health Review Board is a lay board of 3 members, 1 representing employees, 1 representing employers, and 1 representing the public. The board makes quasi-judicial determinations on contested OSHA matters. Similar to how appellate judges deliberate after an oral argument, the board members benefit from the opportunity to close the meeting, ask questions of their Assistant Attorney General, and debate the strengths and weaknesses of each party's position. Before that point, it is a public meeting where members of the public can come in and listen to the positions of both parties. At Section 3, the changes to the board's authority are proposed in response to the Minnesota Supreme Court's decision in October of last year, the Trinity decision. The Trinity decision interpreted Section 14.62 and held that the Commissioner of the Department of Human Services did not have statutory authority to remand to an administrative law judge. The same issue that the court addressed in Trinity is also presented in the language of Section 182.664. Currently, there's no explicit ability for the board to remand to an administrative law judge, but the board has proceeded on the assumption that they did have that authority up to the Trinity decision. Revisions to this section also clarify the board's authority when a party files a petition to vacate a final order related to occupational safety and health. At Section 4, the proposal would fill a gap in existing law by providing that all appeals from the board to the Minnesota Court of Appeals are covered by the Minnesota Administrative Procedure Act, Chapter 14, including appeals of board decisions regarding petitions to vacate final orders of the commissioner. This change is necessary to ensure that the department, board, and parties who may be considering an appeal have a direct answer as to the process that applies. Section 5 is an amendment to 182.666, which concerns penalties for MNOSHA citations. Current law provides the factors that MNOSHA uses when issuing penalties: the size of the business of the employer, the gravity of the violation, the good faith of the employer, and whether the employer has a history of previous violations. The additional language proposed in the bill explains that the general factors for agency penalties, which are found in 14.045, do not apply, as more appropriate specific factors have been identified in Chapter 182. It's also important to mention that these specific factors match those used by federal OSHA, and so would ensure that MNOSHA's state plan and penalty structure match the federal system. Section 6, Section 182.667 currently provides for criminal penalties when an employer willfully or repeatedly violates MNOSHA standards. The language we propose clarifies that MNOSHA may share its investigative data with a city or county attorney's office. This will ensure that agencies with criminal prosecution authority can adequately consider criminal charges and promotes efficiency. And finally, I'll address Section 7 and 8 together. Last year, an occupational safety and health standard governing ergonomics was enacted at Section 182.677. The language proposed makes technical corrections to the standard at line, at line 5.11, clarifying that it's the employer who is required to create and implement an effective ergonomics program. And secondly, by revising the definitions of warehouse distribution center and meatpacking site for consistency of application. Specifically, the bill proposes to change the definition of warehouse distribution center to be site-based, which aligns with the definition of meatpacking site. Thank you for the opportunity to testify in support of House File 3957. I'm available to stand for questions.
Any questions? Representative Schultz.
Thank you, Mr. Chair, and thank you, Representative Greenman. I do really enjoy this conversation we have around this table and the people at it. I just wanted to ask a question following the lines of the ergonomics, which you were just talking about. I'm not sure, I apologize, do we have anybody from the department here with us today?
Mr. Chair, we also have, we have the deputy counsel, but the DLI also has bills being heard in the Senate, so, because they're at the same time, and so we have the illustrious deputy counsel, but not other folks from the agency.
Thank you.
Representative Schultz.
Thank you, Mr. Chair. So ultimately, would love kind of a report on how ergonomics has gone with, and there was some work to help kind of make sure that didn't go into effect as quickly, and it was moved to January of this year. And so I was just seeking an update there, and it looks like, we're changing the language here. So can you just maybe provide a little bit additional context to what this change in the ergonomics language means?
Representative Greenman, or?
Yeah, I'm going to take a swing at that, and then I may turn it over to you, Deputy Counsel, because, and I think that I feel like we can pass on, and I think the legislative, the liaison is here about sort of how the ergonomics piece is working. We heard a lot of testimony last year from the meatpacking industry, from the warehouse worker industry, healthcare, about it and the need for it. So I am also interested in hearing how that's going. These definitions, it is my understanding, are purely technical to make sure that they align with OSHA. So when I asked the question about the warehouse worker piece, because that was my bill, the way that we drafted it, which I think it sort of won't change the result, but was about employers and not about site. And OSHA is site-based. And so if you see the way that we sort of reconstructed that piece. And so I will turn it over to you, but it is my understanding that we are basically just better aligning bills into the OSHA statute.
Ms. Sajak.
Thank you, Chair. Yes, Rep. Greenman described it accurately. So meatpacking site was already defined appropriately as a site-based. The term warehouse distribution center, the way the phrase works makes you think of a site, but the actual definition did not match the site base that we had intended to use OSHA data to determine which sites would be applicable.
Representative Schultz.
Yeah, thank you. Just a quick follow-up. I mean, I appreciate that. Glad to get the clarity on it. And at some point, it sounds like maybe not in this particular committee, but we can have a discussion around how that's working out. And in particular, I really wanted to talk about the healthcare facility piece of it too. But that can be another conversation.
Any further, Representative Hill, do you have a question?
You sure?
I thought I was whispered, okay. Any other questions? Representative Myers.
Thank you, Chair. Thank you, Rep. Greenman. I'm wondering, the changes made here, did any of these come from conversations that you had or what the department heard from owners, operators, and employees?
Representative Greenman.
Thank you, Mr. Chair. I'm going to turn that over to the department. Given that these are technical changes, my understanding it sort of aligns with what we oftentimes do is the technical bills of ensuring that sort of everything fits in the statute, but that is a better question directed for the department.
Ms. Sajak.
Thank you, Chair, Representative. To my knowledge, these are all internal housekeeping issues that we flagged with the statute or came to us through the revisor's office, not from outside parties.
Representative Myers.
Yeah, thank you for that. And one follow-up. So, we heard a previous bill where there was some feedback provided by owners, operators, and employees and changes that were made. Has the department heard of any, constructive changes that they may be bringing forward on this at a future time?
Ms. Sajak.
Thank you, Chair, Representative. Not to my knowledge, but I can certainly check with our policy-based folks outside of my expertise, and we can get back to you on that.
Okay, thank you. And I just want to point that out because some of the pieces were studied for a very long time, and the implementation was pushed back a little bit. But when you study something for 10 years and then, you're asking to get it implemented fairly quickly, and then we're kind of back here, I'm just interested to make sure that we're listening to kind of the boots on the grounds, both from both sides, for any potential changes or fixes.
Any further questions? If not, you want to do your follow-up and then renew your motion?
Yeah, thank you, Mr. Chair. And I would just say, and I appreciate that question, Mr. Representative Myers. And as the bill author of one of these pieces, I actually haven't had anyone come to me on that. And I had a lot of conversations with Amazon and others, particularly because the lobbyist is a constituent of mine. But so appreciate that. And if folks either come to the department or to us, but I have not heard any follow-up. Mr. Chair, I will renew my motion. This is the technical bill, so I'd ask for your support. I'd renew my motion to send House Bill 3957 to House, have it re-referred to the Judiciary, Finance, and Policy Committee.
The motion's been renewed to send the bill to the Judiciary Finance Committee. All in favor, say aye.
Aye.
Opposed? The ayes have it. The bill's referred. Thank you. And thank you, Ms. Sajak. And with that, members, that's all we have for today's. Representative Schultz.
No, just a general question for us. You know, the commissioner did present before us, kind of providing a little bit of an overview. Will we have the chance to discuss with the commissioner or the department on more of how the implementation on a lot of the new things are going before committee deadlines?
We can find, we can try and find time for that, yes. Later on, we'll get bills that we have. On Tuesday, we have a bill that's being introduced today. We're going to hear the,
You're going to love it.
you know,
Great, it's a really good bill, actually.
I've heard about it.
yeah, anyway. And we're filling in what we got, and if we have time, we can schedule the commissioner in. Part of the problem has been Labor and the Senate meet at the same time, and they, even though we put our agendas out before they do, they seem to want to copy our agendas, so she's got to be in two places at once. And that's the problem we had last session, and we're having the same problem this session. So we'll try and get it done. Any further questions before we adjourn? If not, we are adjourned for today.